So unfortunately, Jen, who's supposed to chair our Learn and Share event today, is will be 50-50 because she's having issues with the internet and connections, probably same with Verity as well. But I think she will be on the call at some point. So for the meantime, you would have to do with me. And unfortunately, like I said to Katie, I won't be singing because I do charge quite a lot now if people want me to sing happy songs in a minute. Welcome everybody. And first of all, say thank you for submitting your interim reports. It looks like everything is going well for all of you. And today we'll really be listening and we'll be listening to a bit more of what you're doing within the project, and if there is any issues or anything that you would like us to pick up, or anything that you think the regional leads will be able to help you with within the project. As mentioned on the agenda that I sent out, each project today will have about 15 minutes to do your presentations. And if you can allow, probably towards the end of the session, we'll have a question and answers where everybody will be able to chip in. And if I can also mention that we've got our National Awareness Day calendar, which will be used as part of our comms work, which will try to highlight some of the work that you guys will be doing. And just to give you a heads up, you will probably receive emails from myself or Verity just to ask if it's possible we can use some of the quotes from your projects to do a comms on Twitter or some of our social media platforms. It's just to give awareness and to highlight the importance of the work that we're doing. And without eating much of the time, we'll go straight into the presentations. Hopefully we've got the presentations running from now until we have a break for about 5 minutes at 5 minutes past 2. Then we'll continue after that, if that's okay with everybody. So do we have Samantha? Are you online, Sam?
Yes, I'm here. Hiya.
There you are. Yes, the floor is yours. You're the first one to go.
Oh, okay. Thank you. So nice to see everybody. I'm Sam Ferguson, the Training and Volunteer Officer at York Carer Centre. We've kindly been given external funding to get involved with Mind the Gap. We completed a 6-month scoping project last year, and we're now in a position to embed some of the recommendations that came out of the report. So can we move on to the next slide, please, Steve? Yep. Oh, and the next one. So what have we planned to do? Well, we've planned to arrange for a group of carers to come together to talk about how we can implement some of the recommendations that came out of the report. And so far, we've held 5 steering groups, and we've had a great response from the carers. They're really keen to get on board and get involved in embedding some of the recommendations. I don't know if I did say, but it's substance misuse. So we're supporting family members affected by addiction and gambling. So we also have planned to put in place a monthly support group for carers, which we are now doing. And we actually hold 2 every month. So we hear from carers on a Tuesday evening to accommodate working carers, and 1 group on an afternoon. And we've also arranged a wide range of information and training for carers that they've asked for. I'll go into a little bit more detail further on. And to build further communication networks with other professionals across the city, and also people in recovery. So we're making great headway with other organisations such as the AA, NA, Drug Treatment Services, and others. Developing partnerships with them. We are looking at holding a marketplace event in December, which is a great opportunity for other organisations to come together with some information to share with unpaid carers affected by addiction. So we're inviting other services and people in recovery to come along, and carers that are caring for somebody with a drug and alcohol problem or gambling addiction to come along and meet with them. And all these things are, what carers have asked for. So they tell us really, what they'd like, and I'm merrily running along at full steam ahead, trying to, get involved and get everything going to meet their needs, because that's what's really important. We're a very carer-led organisation, and that's what we're doing. We're listening to carers, and that's working well. Yeah, and then obviously we'll find further findings and recommendations, no doubt, and we can then present the outcomes to you guys, our funders, and hopefully further down the line secure some longer term funding. So that's where we are at the moment. Can we move on to the next slide? So the steering group was put together really because when we received the recommendations out of the report, we wanted to make sure that carers could have the chance to think about what they would like. So some of the things that came out, carers said that they would like to hear from services, and we asked them what services they'd like to hear from and what information they would like. And they said, now then, just bear with me. They said they wanted to hear from an organisation that supports both the addict and families. And so we've got plans in place to speak to a local organisation that might be able to come forward and talk to carers about what it's like supporting family members and the addict. They asked if they could speak to somebody from a rehab to sort of demystify what goes on when their loved one goes into a rehab. So again, that's on our list of things to do. We want to try and get someone from a rehab to come along and talk to carers about the process and their expectations, and so that carers can ask any questions about what it's like for their loved one to go into a rehab and what the expectations are for them and how much input they can actually have, if any, really. They asked if we could arrange for some training from mental health services. So we got in touch with 2 local organisations, and we've managed to arrange for a counsellor to come and deliver some training around anxiety and depression, and for York Mind to come and deliver a training session focused on their well-being. They asked if we could share our training, because we have care awareness training that we deliver to professionals across the city. They asked if we could ensure that this was made available to more GP practices and to local health organisations and the Integrated Care Board. And so we're making sure that happens. In fact, they're very good actually at receiving our publications and disseminating across the city of York through the Integrated Care Board. They asked if we could make arrangements for somebody that was a substance misuse liaison link to come and talk to us from the hospital. So we've managed to do that. And we've had somebody from a drug treatment service come along that's based within the local hospital. And we've made plans for somebody from a liver specialist to come along at a future group to talk to carers about the work that they do. And the carers said that they would like some training as well, and they would like some more drug and alcohol awareness training. We offer this from time to time, and so we've been in touch with a local training provider and the local drug treatment service training provider, and we're able to offer them something in the new year around that. So then thinking about which healthcare professionals they wanted to invite, other than GPs, we were looking at mental health professionals, inviting more of those guys to our training, maybe GP receptionists as well. And when we talked to carers about how we can improve societal perceptions through a PR exercise, this created great discussion and lots of ideas about how we could do this. And carers have been really keen to get involved in putting a flyer together. We've sort of looked at the idea of a book and a leaflet, etc., but they've settled now on a flyer, and we've met already and drafted a flyer ready to be looked at by our managers. So we're really getting cracking on things, really. And, as I say, because we're a carer-led service, they've come up with the title and all the information they'd like to put in it. We've identified a group of carers that want to be part of the distribution team, and we're compiling a list of organisations where we can send this flyer electronically and physically. We talked also about putting a press release together and ensuring that substance misuse carers were included in our newsletter, which they are anyway. And our groups are very well advertised in our newsletter and our monthly e-bulletin. And we talked also about the marketplace event and the opportunity to bring everybody together. And they were really keen on that idea, that they would have the opportunity to meet with people from Alcoholics Anonymous or Smart Recovery or from other organisations, all in the same place. Yeah, where are we? Can we go to the next slide, please, Steve? So keeping things going, in the long run, we'd like to continue everything that we're doing and develop some meaningful partnerships with organisations that perhaps we haven't touched base with for a long time, perhaps some that we do have some good relationships with, but look at new ways of working. And we'd like to continue to be able to offer regular monthly support groups and training and workshop events that we do. We want to continue to share good practice. And obviously at the Carers Centre, as I touched on already, we really do like to ensure that carers' voices are heard and encouraging carers to get involved in other services such as ADFAM's Lived Experience Advisory Group and getting in touch with our Carers Action Group. And ultimately, we'd like to continue to get more funding to continue this, to support this group of people that are not often heard. Yeah. Can we go to the next slide, please, Steve? And taking our learnings, we want to share those learnings with nationally and with local organisations. We want to disseminate all the information as much as we possibly can through our comms, through our media channels, through our newsletter, our website, our social media, and our YouTube, all sorts of things really, and work closely with the Integrated Care Board and the local VCSE, and get the word out there about this, group of people that are often hidden, that don't come forward. We want to try to find ways to raise awareness with professionals, to encourage them to think about if someone is affected by addiction, that they are actually an unpaid carer and they can access support with us. We're keen to develop strong, partnerships further with Mind the Gap, regionally and locally. And ultimately, we want to sustain this service. And I think that might be the end of our presentation. So if you have any questions, I'm not sure, Steve, if that's what you want me to ask.
Oh, fantastic. Well, questions, we're just waiting until everybody else has presented and we can get people to chip in with questions. But for the meantime, if people have got any feedback or any comments that they have for speakers, please put them in the chat box and we can pick them up for later. Thank you very much, Sam.
Thank you.
Really appreciated. The next project that we have is from the East of England, which is the Autistic Adults Who Care, and we've got Shana Rain. Shana, are you online?
I am indeed.
Yeah, there we go. Sorry, I can't see you because there's so many.
Don't worry.
Yeah.
No problem. Okay, so I'll start with just introducing myself. Obviously, I think I came across quite a few of you last year, which was brilliant, and it's so lovely to see so many people back and actually taking their projects further, because I know it's been such an experience for us, and actually being able to utilise the second and grow it and reach more people has just been phenomenal. So I'm really pleased to see some familiar faces back here, and I really wish you all success with your projects. So I'm Shana. I'm the Adult Services Director at Autism Bedfordshire. So I oversee services across Bedfordshire, Hertfordshire, Milton Keynes for autistic adults without a learning disability. However, there might be some people that have a very mild learning disability that we can support. Last year, kind of taking steps back to our previous project, we were kind of looking at how autistic carers are supported and what the gaps are and really what the difficulties are as a carer who is autistic. And we had some phenomenal feedback from the adults. I say phenomenal, it's actually heartbreaking feedback. It was disgusting to really hear and to kind of think about all the barriers that were already put in place for these people that are doing an incredible job as a carer. But what's been fantastic about this second year is we've really been able to take those findings into developing something to really support health and social care grow and make these reasonable adjustments for our autistic carers, because we know they do such an incredible job. And they already face so many barriers with being autistic that they shouldn't have to face. So that's been phenomenal. So if we could just kind of move into the next slide. Lovely. So I've kind of given you the background. Now, the background really, so last year's project really focused just on BLMK. This year, we've kind of opened it up to Hearts. So we've launched web pages on both our Milton Keynes site and our Hertfordshire website for autistic carers. So they're aware of when projects are happening. We've also been circulating this kind of throughout newsletters. We've been meeting regularly with providers of care support in the local area. And we've really focused on the marketing of the professionals workshops. Now, these workshops were created off the back of what we learned in year one and what those difficulties were. So we have a series of professionals workshops that we're delivering between now and March about upskilling people that do carers assessment and helping them really to understand an autistic carer's need and how they might make their practices more adjusted and actually, follow the law, which is what we all want people to do. And then, yeah, just the marketing of the carers workshop and really meeting that cohort of people, making them aware of this support that is available to them and how they can get to it. So if you could take me to the next slide. Cool. I'm just telling you about all the things we've done so far because it has really been about mobilisation these last few months. So we've been meeting up with the local carers group. So I'm very fortunate to work within the Bedfordshire and Hertfordshire area. I don't know if many of you are aware of Carers in Beds and Carers in Hearts, but they are phenomenal carers organisations, and I feel very fortunate to have them within my patch because we can make some fantastic referrals to them. But actually being able to meet up with the operations leads and the directors and the CEOs about the project that we're doing and really looking at how we can work together to make sure that the carers that are accessing their services are aware of this, but also how their staff can access this so that when they're going to meetings with local authorities, they can talk about the gaps that they're seeing and that we've seen and fed into them. So it's really kind of bringing everyone together. We've been writing the carers workshops because we didn't have those written before we received the funding. So really kind of pulling those together and working with some of the adults as well to make sure that we've hit the nail of everything they wanted to be considered in those workshops, to make sure their voice is being heard in those workshops. And so far we've run one workshop for professionals and we've run one workshop for the adults. Now, the adults one, absolutely as we anticipated. The professionals workshop, I think I had a little bit of a cry when I messaged Jodie about it because we'd kind of aimed at having, 20 to 30 people attending and we had well over 200 professionals sign up for this. So I think this just absolutely shows the want for professionals to learn and do better when supporting autistic carers, and there's a massive gap in this training that's actually happening, and actually these workshops are really facilitating this and really helping with learning. So if we could move on to the next slide. So there we go, 191 people. This was actually written a week before we'd finished the sign up for it. So at the time I told you that we had 191 professionals signed up. I think the week before when I messaged Jodie, we had like 130 or something. And I was like, I can't believe this is where we're at. How brilliant is it? Just not expecting it to blow up at all the way that it did. We had 5 areas outside of the east of England actually asked to attend because our professional workshops were open for the eastern region. That changed very quickly just because of how much we were, not say very quickly, I had a very long conversation with Jodie about how we're going to manage that, but we are seeing people from all over England inquiring about this, saying we need this support, where do we get this help, how do we make sure that our social workers are taking these things into consideration, what can we take away from what you're doing to improve our practices. So I really want to thank Jodie and the team because I know that you've all pushed this out and you've really made people aware of it within your own network, so thank you so much for doing that because it's really starting to piece together things. So where we thought we would just reach out to the east of England, we're reaching out across the whole country. So again, I just want to say a huge thank you. At the time we'd had 7 requests for people that were unable to attend, but they felt like this was a really important workshop for them to be in. part of what we said we do is we are going to record these. This has been recorded, it's currently being edited and will be on YouTube this time next week, so lots of people can access this and read this, and I can feed that back into you guys at kind of the next meeting to let you know, one, how many hours of kind of social workers and healthcare professionals got from it, but then how many hours have also been utilised via the YouTube channel of people watching it, because again that helps us build a picture of where there are gaps. I won't be able to tell you in terms of the areas of people watching on YouTube, but I can certainly feed that back in from the live webinar, because we asked people to tell us where they worked and what their job role was and what area they were from. But yeah, massively huge success, over the moon with it. For those of you who are there, I'm sure you took great pleasure when my doorbell went off and there was a wolf howling in the background because I hadn't taken it off from Halloween, and that did cause my trainer to look like she might faint. And then if we could just move on to the next one. So I did purposely kind of leave this in Facebook because I just wanted to show you some of the networks that we were using to kind of circulate this, but we are utilising things like our newsletters, Facebook, Instagram, and then our partners that we've been working with to utilise their resources as well. I've been showing it on their Facebook and their newsletters, which is great. We've had people asking about the future sessions, and the resources have already been requested by the adults if they've been unable to attend, because they want to be able to access that information, which is just fantastic. And we're going to try doing these both in the day and in the evening, because we do recognise that some carers are unable to attend during the day because of commitments already, but we also recognise that some can't attend in the evening because that's when their carers' responsibilities take place. So we're trying to make sure we cover all aspects so we can see where we can meet the most amount of people's needs. But anyone who signs up for more information does receive the after information, so the slides from the presentation, the resources that have been made available, and the resources are also put on the website, which lots of autistic people are quite comfortable with, so they can download them and access them for free, and they don't have to attend anything. We just wanted to make sure that the learning was shared as much as possible, but people also had the resources to do things in their own time, because not everybody wants to come to a support group, and that is absolutely okay, but we want to make sure we're still hitting those people and making sure they've still got the information that they need. Next slide, please. And that is me, and I'm sure those of you who met me last year will be shocked to see how quickly I did deliver this, because normally I talk for so long you have to move me on.
Thanks, Shanna. Yeah, most of the time I'd have been time out, Shanna. That's it.
100%.
Well done. No, thank you very much. If I can just remind people that we're more than happy to share any workshop or events that you have. If you can send the details, we'll be able to share them via our workspace on Futures platform, because we've got a wider reach of people there and networks. So please feel free to send us any information that you might have. I'll put our email address in the chat box. So please, any events or workshops that you have coming up around our Mind the Gap projects that you're working on, please feel free to share.
Thank you.
Thanks, Shanna. Our next project is from the Northwest, which is caring for carers from Asian communities. Elizabeth, are you online?
Yes, I'm here, Steve.
There you are. And it's all yours.
Thank you. So, hi, first of all, good afternoon. I hope everybody's okay. It's a bit cold, damp, rainy up here in the north of England. Actually, no, I just looked outside, the sun's shining, so it's okay. So this is a continuation, and thanks to all Stephen, everybody else in the NHS team for funding this carrying on. So last year we started working with a group of amazing women from the Asian community from different parts of Greater Manchester, so from Oldham, Tameside, Rochdale, and they wanted to carry this on, and we, even though the funding stopped from last year, the project funding, we carried on meeting anyway, because we built up such good relationships with each other. We understood each other's family situation and supported each other, I suppose. And the carers that were coming along to those support meetings, they learned a lot from me and from other people about the importance of things like registering at the GP practice to tell them that you're a carer. We just shared information, and I think one of the things that came out quite strongly was that people who are caring from within the Asian community, first of all, don't recognise themselves as carers, and second of all, the stigma attached to asking for support from if you're struggling to cope from within the Asian community is absolutely huge. If, and this is a sweeping generalization, so it doesn't apply to all families, but if you're asking for support for caring for a relative and you're from within the Asian community, it's seen as a bad thing because you should be supporting your family members. That's what you're taught when you're young, and that's how things happen. You shouldn't be asking for support from outside the family. And the other thing was lack of support to culturally sensitive care. So having a care agency just come along and send some people into the house was not good for carers from within the Asian community because it didn't work for their cultural attitudes and the way they operated within their household. So I'm really, really pleased to be carrying on with this project because we came up with so many great ideas last year. I didn't just want it to stop. So I'm really thrilled, and the rest of the team are really thrilled as well. So what we've got for this year, Steve, can I have the next slide, please? Okay, so we've changed our name slightly, so Asian Carers United. And I think I've only just done 2 slides, Steve. So if you can just move on to the next one, that'd be great. Okay, so across Greater Manchester, there's 10 local areas. One of the things that we spent a long time doing last year was getting a support directory, which is now 25 pages long. It lists all the mosques, the contact details for the imams, phone numbers, email addresses, really small support groups on Facebook, and anything we could find really that was out there supporting and working with people from the Asian community across all of those 10 local areas. And that was a massive task. I think when I put that on the original bid, I hadn't really realised how long it was going to take, and it actually needs continuously updating. But it is such a fantastic resource to just have it there. And I get people from Rochdale and different parts of Greater Manchester coming to me and saying, have you got the list for whichever local area they're from? Because it's an easy way to get. It's already been done, so I just send it to them. Who are we working with? So it's mainly, at the moment, it's women from the Asian community. We did approach some large organisations who already support carers from the Asian community, but they were a bit hesitant and a bit reluctant to get involved because I think their feeling was that they already did that work. So why would they do it on a bigger scale? We're hoping to challenge some of those cultural attitudes, should we say, this year. We want to essentially develop a better support offer for carers from the Asian community. And we're working really closely with the integrated care team, have regular communication with them. They're really keen to help and support as much as they can. 2 really important things that we're doing this year. One is a Family Rights Day, which is actually going to be in February 2023, not 22. We can't go backwards. We've booked the British Muslim Heritage Centre for that already. We've appointed a project officer from the Asian community called Nissa Abdullah, and she can speak about 6 or 7 different languages. So she's able to communicate with people whose language is not even written. So it's a dialect of a particular language. She's an amazing lady, and she's really keen to change things and support us. So she's going to do a lot of the interaction with all the people on the support directory, essentially via email and phone calls, etc. This Family Rights Day, we talked a lot about this last year, and we said that we didn't want to advertise it as a Asian Carers Rights Day because this is the ladies talking that I work with. They felt that would put people off. That 1, they don't see themselves as a carer, so why would they come to that? And 2, perhaps it would be a bad thing or stigmatized a little bit within the Asian community. So we made a conscious decision to call it Family Rights Day. We're also making a really conscious decision to promote it and advertise through schools. So I have a lot of networks and contacts across Greater Manchester who are already working within schools. So we're going to advertise it through young people and basically encourage them to get their parents, their grandparents, aunties, uncles to come along and find out about what benefits are available for them, hear about what primary care can do to support their family. We're not advertising as carers, it's more about support for you as a family. And that's been a really conscious decision to do that. Also faith leaders, and the carers, all of the carers support agencies across Greater Manchester will support this. So we're just in the throes of developing like an event project plan and what the advert's going to look like and what dates we're going to send it out and etc. We would absolutely love somebody from your team, NHS England team, to come. We have invited Andy Burnham and Paul Dennett, who Paul leads our integrated care partnership. We have sent invitations to them. It's going to be the 23rd of February. And hopefully they'll come along. We don't want it to be a formal event. We're not making it formal. We are going to have childcare there. We're going to have interpreters there. We're going to have lots of food and things like that. We're going to make it a bit fun. It's not going to be a formal conference type thing. So that we're really, really excited about. The girls have got such amazing ideas. And the second thing is the Greater Manchester Asian Carers Network. So the support directory that I already have, which is 25 pages long or however long it is, we're inviting all of those services, all of those individuals, all of those organisations to be part of a bigger Greater Manchester network. Not all of them will want to be, and not all of them will want to come to meetings. Some might just want minutes of meetings or to be involved on the periphery. Some might actually want to come and influence and make a big impact. And that network is, I'm hoping, going to be supported next year by the Integrated Care Partnership. We had some other ideas last year, for example, like doing an online short e-learning training package for professionals working with Asian community carers, which I'd really like to take forward as well, but funding didn't allow it this year. So I'm hoping that the Greater Manchester people will contribute or fund that. Why are we working with this group of people? What is it about carers from the Asian community, I suppose, that attracted us to having this as our focus? I think certainly in Greater Manchester, there's quite a lot of focus on carers from Black and Afro-Caribbean communities. We've got a fantastic Caribbean African health network. Sorry, I've got my daughter sitting next to me. She's just doing some colouring. So I felt quite strongly that carers from within the Asian community weren't heard, and were just sort of left. Whether that's true or not, I don't know, but I didn't feel their voices were coming through any of the conversations that were going on. So really, that's where it came from, and it started in 2020, actually, in lockdown, when I did the first report into their experiences of lockdown, and the prejudice and stigmatisation, and also the fact that when we did the project last year and found out actually what's on offer, it's not working. And even the simple exercise, I spent about a week going through all of the mosques in Greater Manchester, all of the council of mosques in different parts of Greater Manchester. I looked at their websites and actually came away feeling quite depressed because none of the websites had anything on there. I think there was maybe two. It had information about support groups for women, for example. There was nothing on there anywhere about carers or it. I understand that mosques are there for a religious purpose, but they are an integral part of Asian life for many, many families across Greater Manchester. And I really want to try and change that the importance of caring and the role within the Asian community of carers needs to be a lot greater than it currently is. And the stigma attached to that really needs to be challenged a lot. And I'm just really excited about getting through this year, and what we're going to achieve is all thanks to the team of women that I'm working with. They are inspirational. I know Cora spoke last year at one of the events, and she's carrying on with us this year as well. So yeah, thanks to everybody, and I'm looking forward to updating everybody as we go through the year. So thank you.
Thank you, Elizabeth. I think a lot of people are agreeing with you, especially on the local support directorate that you've created. It looks like a brilliant idea, which is really good. For me, I would definitely come to the family rights group out Family Rights Day, as long as there's free childcare, like you said, you know, just bring my kids and I'll dump them there to look after. Then I'll come back to Leeds to do some work. No, thank you, fantastic. The next presentation that we have is coming from the Northeast, and that's the engagement, consultation and co-production of refugees, asylum seekers and migrant communities in Stockton-on-Tees. And that's, we've got Claire, Karen.
Yep,
Claire
good
and Karen.
afternoon. Good afternoon, everybody. Can you hear me? Just put my
We
camera on.
we can hear you.
Good, excellent. Good afternoon, everybody. So, my name's Claire Gamble. I'm the community projects manager here at Catalyst in Stockton-on-Tees, and we are delivering our project in partnership with Stockton-on-Tees Borough Council. We do have the lovely Karen Shaw with us today as well, who is the service design officer. But I think mostly you're going to be stuck listening to me. So if I can just have my my next slide, please. So where is Stockton-on-Tees? So we're a borough, sorry, located in the northeast of England. We have around about 200,000 residents here, and we're made up of our main town centre, which is Stockton Town Centre, but also lots of smaller towns and rural villages. We are quite a diverse community, whether that be in terms of socioeconomics, race, religion. Is a huge range of varying factors across the borough, and I think so. We're working with carers from within the certainly within the BAME community. We have a wide range of sorry, not rep. Lost my words there. A wide range of ethnicities across the borough, and has one of the largest populations of refugees and asylum seekers within the northeast. So for the first part of the scoping part of this project last year, we engaged with 24 different organisations that operate within the refugee and asylum seeker support service within our VCSE sector. And two of the key learnings that we took out of that were around why refugees and asylum seekers may not have accessed some of the support services, carer support services that are available. Was very much around accessibility and trust. So I think one of the key things that we're looking to improve this time around is that issue of accessibility, and how we work with refugees and asylum seekers to build that trust within not only with some of the kind of key stakeholders in terms of public sector organisations, but also how we can make sure that it is obvious to refugees and asylum seekers that the services we offer are accessible to them. Now, when we talk about accessibility, it's really easy to think of actually are they accessible for people with mobility difficulties, but actually for refugees and asylum seekers, it means something very different, and so it's very much around, when we're looking at marketing materials, is it clear that are they diverse, and is it clear that that actually when we advertise these services that they are open to people from the refugee and asylum seeker community. If they're sending one of their loved ones to a day service, for example, or respite service, is it clear that they have provisions that they can meet their needs in terms of dietary requirements, like things like halal foods? Do they have if it's during Ramadan, for example, are they able to cater for that? Do they offer prayer facilities? And I think what was really clear to us is that we needed to do some work around how we promote our services to make that a lot clearer. And so that brings us on to what we're doing this time around. So if we can just move on to the next slide. So deliberately kept this quite brief so that I can talk around it. So the I think the first piece of work that we had to do was obviously look at our steering group. We reformed our steering group from the first phase of the project, and really strengthened that. Is I think I think we are one of the sites that's had a little bit of a delay. Is had a few COVID outbreaks is within Stockton, and so our main focus is our workshop at the moment. So we're going to be running a workshop which has been pushed back to the 29th of this month, which will look at re-engaging those. So we're re-engaging with those organisations that we worked with first time, and looking at how we can actually take some real steps to improve some of our marketing materials, and look at how we can establish carers champions within different organisations, and whether that be within the support groups that work with refugees and asylum seekers, but also back within those statutory organisations that are kind of really champion the needs of refugees and asylum seekers within their organisation. I think we're going to do that through smaller focus groups, and that will allow us to really co-design the materials that we're using to promote the services. And one thing that I am really pleased that we've managed to do, certainly for this phase 2 of embedding work, is we've actually managed to recruit into a paid role here a new project coordinator, part-time I might add, which is why she's not here today, but a new project coordinator who has come through the refugee and asylum seeker system here in Stockton, and has lived experience of being a carer for her young adult son, and so actually has experienced those barriers firsthand, and can really give us some invaluable insight on what barriers she faced, how she was able to overcome them, and really support the work that we're looking to achieve. So that is where we are up to. And hopefully I have kept within time. Happy to answer any questions at the end if needed.
Fantastic. Thank you very much. I might be losing my connection. Oh. No, I'm still there. Thank you. Yeah, fantastic. We are ahead of schedule, so if people are happy, we can take a quick break, 5-minute break, and we can come back. So it's 45. If we can come back at 13:50, please, if that's okay. Yeah. Coffees, teas, water, juice. Are we all back? See some thumbs up. Good, good. Okay, our next presentation is coming from the Northwest, Courage to Care. That's the veteran carers. Do we have David on the line? I think you're on mute, David.
Yes, I'm here.
There we go.
Yes, hi. So, yes, thank you. I'm David Harvey. I'm the Chief Officer of Cheshire and Warrington Carers Trust. And this is our work around supporting carers who are part of the armed forces, who are supporting carers from veteran families. This is a totally new area of work for us. We took the research phase earlier in the year, and it's the passion of one of our members of the team, who unfortunately has now left us. So what we've had to try and do is refocus, regroup, and see how we can take this work further forward. And because it's new, quite a lot of our tried and tested approaches don't work. So we have to look at different ways to actually try and do the work and make sure that we can actually take forward lots of the elements of the research phase and part of the embedding phase. So on the next slide, we've outlined the steps we've taken so far. So clearly, the first thing we want to do is build upon the research and development phase. We've identified a new staff team member, Jill, who will be joining this group going forward. We've also wanted to do some more mapping and research, because as we came to the end of the research phase, the work we've done has actually identified more organisations that wanted to work with us and how we can actually involve them in the new stage of work. So what we're doing is looking at setting up a focus group of all the organisations who are currently supporting armed forces families in the area, to make sure that it's a joined up group and it's not just us doing it in isolation. We've also looked at the findings of the British Red Legion, the Royal British Legion 2021 report. And what we want to do is have a local response to some of the issues that they've raised. In terms of our strengthening links with armed forces families, we are now working with the 7 local British Legions. They each have a regular breakfast club. We've got an open day at the barracks in Chester in December. We'll be developing new promotional materials, including a dedicated page on the website. And then looking at working in partnership with other organisations who are currently also trying to support armed forces families, in particular Health Watch, the local advocacy providers, and the specialist housing providers for veteran families from the local authority. We're also trying to work with the Royal Navy Association, SAFA, and all the organisations that are there to provide support for armed forces and their families, but aren't aware of the caring responsibilities that those families may have. And we're also trying to raise awareness of caring within existing families. So on the next slide, we're attending all relevant groups and activities to promote both the generic and targeted support and services. And one of the things is we are distributing the Household Support Fund on behalf of Cheshire West and Chester. And we're using that as a little bit of a hook to actually identify some families by advertising the fact that if carers are struggling with utility bills or with the cost of living, we have small amounts of funding we can actually help individual families through the Household Support Fund. The other area we're working around is we have a project as part of our generic carer services, working in GP practices to identify and support carers. And we're now working with those GP practices to look at armed force families, particularly newly registered ones who may not be aware of the services that are available to support the carers. We're also keen to produce and work with the lived experience of families. We have a volunteer who was in the armed forces, and he's been able to give some really good insight into some of the impacts and some of the issues that caring families face, particularly when they leave the armed forces. So we're actually looking at publishing a number of stories of families locally to actually highlight some of the key issues. There's nothing better than a member of the target group of carers we're trying to support in actually saying how it is. And again, trying to work in partnership with the Armed Forces support organisations, making sure they don't think we're duplicating their work. We're clearly not trying to do that. They have some excellent support services, but trying to make them a bit more care aware, and trying to have those links that if there is a family out there with care responsibilities, they know that they can access our services as well as the general dedicated support from the Armed Forces support organisations. And just an example, there's been a recent turnaround of personnel at one of the army barracks in our area, and 200 new families have just registered with the local GP practice. That's given us a really good insight into actually working at how we can identify those 200 families, working in partnership with GP practice, so that they can all be made aware. So increased publicity, promotion, and we've developed a very simple presentation that looks about what our services are, how they can be offered, that we can then send in electronically, remotely, so that if caring families can't meet us face to face or aren't able to attend any groups, we can do things in a more electronic, more remote way. So in terms of the contact details, my colleague, on the next slide, please. My colleague Jill is our engagement, comms and volunteer officer for our organisation, and she's taking on the Mind the Gap embedding phase, supported by myself as chief officer. And what we're trying to do now is to actually take further forward the ideas raised in the research phase through the embedding phase. We significantly want to engage with more families, have the stories, and actually come up with some tangible outcomes for those families that engage with us. So that's the brief update on our service.
Thanks, David. Really appreciate it. Just a quick question. So from going forward, will Jill be the best contact in terms of the project?
If you copy myself and Jill into it, we work collaboratively. Jill's part-time, so I'll be overseeing this project. But yeah, if you copy Jill in, that's great. Thanks a lot, Steve.
Okay, thank you. We've got a question from Jodie regarding the local GP surgeries, but we can pick that up later. You can have a look in the chat box as well. If we can move on to our next presentation, which is coming from the Southeast, which is Courage for Carers, another veteran carers project. We've got Katie Humphreys.
Hello. Hi, Steve. Thank you.
Hi, Katie. You all right?
Yeah, good. Thank you. And I'm also going to be joined by John, our lived experience worker as well.
Oh, fantastic.
Do you want to drop to the next slide, please? So just a bit of background that we are Berkshire Healthcare, so we're commissioned by NHSE to provide our Operation Courage services, which is about veterans' mental health and wellbeing services across Berkshire, Hampshire, Isle of Wight, Oxfordshire and Buckinghamshire. And our project was to, we were with the funding last year, the scoping project was about linking in with carers who support armed forces veterans to get their attitudes and experiences and really hear from them what would help and support them. Next slide, please, Steve. So we're obviously sort of in the planning stage at the moment. We are building upon that success that we had in our scoping project. So we had a project group working on that. We had a real nice mixture of service managers, psychologists, veterans, peer support workers, carers, and Marcoms people. And we've refreshed that group and we've refreshed the terms of reference and our project plans. We have completed a risk register, and I'll go through some of those in a minute. And really we've revisited some of that carer feedback and are identifying the work streams and the outputs that we're going to work on and move forward. Next slide, please. From when we've submitted the bid, we did have to revisit some issues because actually the service model is going to be changing with effect from April 2023. So we have, as an organisation, re-tendered for the bid to provide the Op Courage services across the patch, but we won't know until December whether we've been successful or not. So we need to be mindful of that, and within the work streams that we're doing, have something that's going to be sustainable, both and aligned to the old and the new service delivery models, if we are successful, and or something that someone else could take forward as well. So we've also rejigged some of the project group, because members of the group were originally linked into some of that tendering process as well. But the plus side of all of that is that actually we've got much more engagement, and we've got a new family support worker role as well as our peer support worker. So we've really able to work with those people to embed lots of our outputs within what we want as our business as usual going forward. So all of that has also linked to a delay. Some of our outputs we were hoping to put on our new Op Courage website, but that's going to have to be slightly delayed. So there'll be some interim Marcoms channels with all of that. Next slide, please. So as part of our engagement with carers, we worked closely with the Ripple Pond, and we were lucky enough to be able to reach out to their membership, as well as some of the other networks that we had through various contracts again across the armed forces networks. We conducted some quantitative data with some questionnaires, semi-structured interviews, and then we also held some focus groups and one-to-one interviews. And from that feedback, we got lots of really rich data that we were able to use as the baseline for what we wanted to move forward and develop. At this point, I'm going to hand over to my beautiful Debbie McGee, and he's going to talk through some of the emerging themes that we had from our carers.
Do you know what? I've been called a lot of things in my life, but never Debbie McGee. So I'll take that as a plus. Can I have the next slide, please, Steve? Thank you. Yeah, just I'm John Gemspike. I was 22 years in the military and left with mental health and physical issues in 2016. One of the things that that Katie mentioned was about the fact that we've got a very varied team which is trying to deliver this. Within our service at the moment, we've got about 250 years worth of military service across all three services. And that includes family members as well, who have acted as carers as they're going along. Now, I know for a fact that I could not have been sat here talking to you today without the input of my family. So I feel this one's very, very close to my heart. Funnily enough, you will realise that some of the emerging themes, and I think this probably comes out across everybody really, the label of carer didn't resonate with a lot of the people that we actually spoke to. You know, I'm not a carer. I'm not being paid as a carer. It's just not a phrase that's there. It can also be things like the tone, the imagery. We've had to be very careful with it. That's not the uniform I'm used to seeing. You're using language which is referring to a different service. All this kind of stuff is very clear, and I think there is a certain level of uniqueness in caring for veterans. We're very good at looking at the veterans themselves, but we do tend to forget the people who are stood behind them, actually doing the hard work in order that they're actually able to go out there and do what we do. So I think that's really important. Some of the stuff that we really found was going to be helpful was actually raising awareness of the conditions as much as anything else, which a lot of families were. It's all well and good going and seeing a clinician a couple of times every few weeks for a couple of hours, but actually the families and those close to them are living with the individual 24/7, and they'd actually like to know what's happening. And I think one of the key things there was exactly how we can support veterans after the challenging sessions. Because they can be those people, those of us who've been through any kind of therapy will know that you'd come out and it can be quite emotionally draining afterwards. And I think another one, the key one, is the boundaries of acceptable behaviour for somebody, for example, who's dealing with mental health issues, is actually talking to each other and just seeing exactly what they're going to be facing. One of the biggest problems that we saw as well was carers tend to prioritize the person they're caring for ahead of themselves, and I think that was something that we picked up on a lot, and especially with the military attitude. Quite often, it's very much of a, if you pardon the phrase, it's a case of man up or shut up, and that extends to the families as well, which can be incredibly divisive, and it does lead to isolation. And actually, I think sometimes asking the question of how are you doing, not how is the person you're supporting doing, all of a sudden people were thinking, hang on a second, I actually have a vote in this. Coming also from the MOD system, with the medical system, it is very different from the NHS. And it can be quite frightening when you step across from a system which can quite often, the MOD system, which can sometimes actually help you and support you when you step outside, and all of a sudden you've now got to fight for appointments to see a doc and things like that, which is really difficult. Could I have the next slide, please? We looking at some of the planned activities that we were going to be doing. I'll not read the whole thing off here for time as much as anything else, but some of the various bits and pieces that we were actually looking at. It's getting the information out. How do we get it out? Actually recording the carers' input on the official systems, and actually not waiting to sort of design this, but actually trying to drag the information out from the information that we've got at the moment. And also trying to be able to work out exactly how do we manage how do we assess the impact on the caregiver's well-being. And we've looked at some various bits and pieces here. We do realize that we've got, as Katie said, we've got quite a lot of data which has come in, but actually making sure that we can actually do something with it. We've got that data, but so what? What are we actually doing coming off the back of that? I think that's a really important thing. The next slide, Steve, please.
I think it might be back to me.
Is that back to you? Go for it.
I think so. So just picking up there, so one of the things that the carers had given feedback on was that they can't always get out and about, and that the caring is part of a role that they're fulfilling. That's why we went with the virtual clinics idea as well, so that actually people might have the time to jump in and see if they could get that help and support from and contact with some of our lived experience workers. And with that in mind, we'd also originally had the idea of potentially a directory. So I doffed my cap to was it Elizabeth earlier who managed to get her directory. We weren't sure that we'd be able to do that effectively, and whether there was a bit of duplication there through some of the information that was already out there. And what we got feedback wise was people talk about support, but what does that really mean, and what does that look like? So we wanted to put some meat on the bones of what that would look like, and come up with some case studies, very much tracking how some of our new family support worker role could help and work with families to go beyond signposting and building really connections. So that's part of our plan in this, and we hopefully will get some of that engagement through the work that the family support workers doing and the people visiting our virtual clinics is the plan.
Can I just add something in there as well, Katie? Because Katie's been very good and mentioned the word which I hate more than any word, which is signposting. The suggestion of somehow actually what we want to do is actually get people to the support they need, not just send them off in a direction whereby it's a case of I don't know what to do with you, head off in that direction and good luck. So in fact, we want to get people and walk people to that information as much as anything else.
Perfect. Next slide, please. So this kind of links into the fact that what we have actually done is review and revisit our skill mix within the team, and we've created this new role. So what we're still doing is putting the referral pathways in place, working out the documentation associated with that role, creating materials to support the new role, and how we can record things on patient records, because we do have some challenges within that, working across different ICS footprints and also different areas and the different patient records that exist, and where you then record all your support. So we're working through some of those governance type issues as well, to make sure that we can continue to support people and really embed what we're doing with our friends, family and care activities as our business as usual, and part of this new model and new service that we will hopefully win a bid for in the future. Next slide, please. And linking back to the feedback that we'd had from carers about education and training and awareness, we had a lovely idea that actually there's a charity called Reading Force that works with families of serving personnel and veterans to read with children to help them understand a variety of situations and link in with them whilst potentially their family members on active duty and things like that. So we were wondering if we could work with Reading Force to maybe have some kind of book or story about what it's like to leave the services, and or if someone is having some challenging times because they have left, but maybe through physical or mental health issues, if we could have some kind of book to explain that you'd have a resource then for people to share with the children and help their learning and understanding of that. And kind of toolkit for parents to facilitate those discussions. We've realised that within the confines of this project, we might not be able to do that completely, but there might be ways that we could use existing books, maybe through CAM services, to do what they call this scrapbooking, where you share that resource and then you make memories together, and Reading Force have that in a kind of a, I don't know, a booklet for want of a better word. So we've linked in with them. Discussions are ongoing. It's something we feel quite passionately about. We might not quite be there yet on this one, but it's something that we're looking to do some more scoping on for the future. Next slide, please. I think that's it from us then. Any questions, we'd be happy to take them in the chat.
Thank you, Katie and Jonathan. Really appreciate it. Or should I say Debbie? Fantastic.
I just know now that the name's going to stick now, Steve. Thanks very much. I really appreciate it.
No, thank you. Very nice of you to come along, and we always appreciate lived experience, and hearing from somebody who's got that experience is always welcome. So thank you. And like Katie said, please, any questions or any comments that you might have for them, please put them in the chat box. We're continuing with the theme of veteran carers. The next one that we have is Chris from our Dorset, which is Dorset Armed Forces and other veteran carers. So, Chris, are you there? I can't see you.
I'm here.
Yeah, there you are. Yeah.
But first of all, everybody, I'd like to introduce Di, an absolutely brilliant volunteer who's helping us out. And like our two previous presentations have covered, it's so important to have that lived experience because we're not a military charity. And so to understand more about the military and how we can best work with our colleagues there, people like Di are helping out. And Di is going to kick off our presentation about explaining why she's involved in our project and what she's getting out of it. So Di, the floor is yours.
Good afternoon. I just want to say thank you for allowing me to speak. I agree with Debbie McGee. In fact, he's taken a lot of my points. Armed Forces veterans are different. I served for 15 years. I got out because I became pregnant with my first daughter. My second daughter was born with a severe heart condition, and I became a carer. But as Debbie said, I didn't think of myself as a carer. I was a mum. And at the time, for people with a severe heart condition child, there was no support at all. So I set up a support group for parents of heart children, and that's still running today. But why I'm involved with Chris is because now I'm a cared for person. And as a veteran, it took me a long time to put my hand up and say, I need help. I moved from I moved from Hampshire to Dorset a week before the pandemic kicked off, and I had to isolate for 4 months. I didn't know anybody. And after two months of being in on my own, I tried to find a veteran support group, because in Hampshire we had a very good support group. The one I found was the Veterans Hub in Weymouth, which is great doing, but it's too far away for people in Poole to get to easily. So I set up a drop-in centre in Poole, and we just meet for bacon baps and a bit of a chat. Through that, I found a few carers who, again, don't think they are carers. And that's where I met Chris, because he came in wanting to know how he could help veterans, because we are different. And one of the things that's not been mentioned so far is there's different age groups. So it's great. There's a lot of things on social media, but in my group, I've got an 88-year-old and a 94-year-old, and they've never heard of Facebook or and they come to me and say, Di, what do I do about this? So that's worth thinking about. Thank you for letting me talk. Back to Chris.
You're on mute, Chris. You're on mute.
Sorry, thank you. Yes, that was really interesting what I was just saying. I just wanted to highlight Di is part of a group of carers and cared for people who are helping us when, as I'll explain later, when we're engaging with other partners about the experience of carers from the armed forces community. So just briefly on our project, very similar to the two previous projects you've just heard about. It's a partnership between the Defence Medical Welfare Service, which is a specific military charity which supports people with their health and well-being, NHS Dorset, so that's the ICS, the Integrated Care System down here, and also, as Di said, the Veterans Hub, which is based down in Weymouth. Next slide, please, Steve. And what I'm going to just talk to you about is why we're doing the project, and particularly its aims and how we're trying to involve carers and care for people in it. So that lived experience. Next one, please, Steve. So this project we're now in is born out of last year's work, like everybody else here today, and we're really appreciative of this opportunity, and so thanks for the ongoing support for it. And the first thing we're doing is we're just wanting to find out more about the experiences of carers. We had a really good response last year with 202 people responding, but we're wanting to build on that. And particularly we're wanting to make sure that we get good coverage across the county. And so we're hoping to get more from Conurbation of Bournemouth, Christchurch and Poole, and particularly from North Dorset. And fortunately, a bit of serendipity the other day, one of the military welfare units we're working with have approached us to say they would like to do some work with us around child carers of serving personnel. So that'll be very interesting. Next slide, please, Steve. But we also want to make sure that we're supporting the people we're in contact with. So we're going back to some of the people we've been in contact with to make sure that they're getting the help, and obviously the people we will be contacting through the new survey. And we're helped in that because the Defence Medical Welfare Service have actually appointed a new support worker down here, and a lot of their time will just be focused on the needs and the aspirations of the carers we're engaging with. And interestingly, the worker they've appointed is an ex-military spouse, so comes with a completely different perspective on army life and serving in garrison towns. And it's just so important understanding the culture of it for the serving personnel, but also understanding the challenges it also brings to the families. And so Rebecca's a brilliant addition to the team. And last but not least on this slide, we've been fortunate because the Armed Forces Covenant Trust has awarded us a grant to develop peer support networks with the carers we're working with. And that grant is a direct response of the support we've got through the Mind the Gap project. So, you know, the money which has been invested is already bringing in other investment into the county to help carers. Steve, next slide, please. And then the other part of the project is we're just wanting to influence all of our partners, so all the support providers who may come into contact with carers. So that can be existing military support teams. So I've mentioned the welfare units, which are based around garrisons. It can be our colleagues in SAFA and the Royal British Legion, as colleagues highlighted earlier. But it's also that great plethora of NHS colleagues, adult social care colleagues, charities out there. We want to influence them around them being more aware of the existence, the needs and the aspiration of carers from the armed forces community. And a very basic message.
Chris, you've gone on mute.
Yeah, I don't know how that happened. Crikey. So a key thing is just getting those colleagues to ask people whether they're ex-services or current serving personnel or their family. If that can just happen, that would be an absolutely massive step forward. And what we're doing, similar to the other presentations you've heard, is we're making sure that we're telling particularly the non-military colleagues how to access support for the carers, the members of the armed forces, people that they're supporting. And then last but not least, we're wanting to build on these experiences of influencing existing services by making sure that the ICS, the NHS, and I apologise for all the acronyms, are actually actively involving carers from the armed forces community in developing strategy and future plans. And lastly, to cover everything, we will also be making a video. We've been quite impressed by some of the videos made by other Mind the Gap areas. Particularly, there was one really good one we saw last year about the experiences of carers of people with addictions. And we thought it was a really good way of getting some of the key points across in a very straightforward way. And so we want to see if we can achieve a similar impact here with the video. Thank you, everyone.
Oh, thank you, Chris. And Diane, really appreciate it. Thank you. I think especially with the videos, once you've got the video and you know it's all ready, please do share with us and we can cascade on our platforms as well. And really appreciated to have you, Diane, on the call today as well. Like I've just said to Jonathan, in terms of lived experience, it's more than welcome on our webinars to hear from people with lived experience. And I think everybody agrees with you regarding the communication channels. You know, organizations should be prepared to make reasonable adjustments for people in terms of communication. Not everybody is used to Instagram. I struggle with Instagram or things like that. So yeah, it's always welcome to make reasonable adjustments. Our next presentation is from the Northeast, and this is using peer-based research approach to understand what matters most to carers of people with drug and alcohol misuse. And we've got Sue Gill and Hazel on the call.
Hi, thank you. Actually, that was the title of phase 1. So like some others on the call, it's great that we've been supported for phase 2. So we're taking that research, working very closely with Hazel, my colleague from South Tyneside Council, and taking that the next step forward, because as we all know, it's really difficult to have the impact you want in 1 year. So it's great to have the opportunity for 2 years. We actually have the opportunity beyond because, as I say, working very much with the council, other VCSE providers, public health team and carers organisations, and actually some of the work that we've been doing it. Hazel's been able to work with the council and build it into their carer strategy. So we're going to be able to take it further and get a sustainable approach. So next slide, please. So building on what we found in the first year, it really highlighted the key themes that were coming out, not just for generic carers, but the cohort that we focused on was around those supporting people with substance misuse or alcohol misuse issues. And we did touch on veterans as well, so it's great to see so many veteran organisations there. And we really took that learning and decided, okay, how are we going to take it forward, building it into the strategy. Next slide, please. And what we've decided is that we are going to develop a toolkit for organisations and a toolkit for the professionals themselves that really supports them to understand the why are we doing this, to increase their motivation, and then provide them with resources, training, etc. that increases their capability and their opportunity to identify but also holistically support carers, especially the hidden carers. Because our goal across South Tyneside is to change behaviour of the whole system, of the whole workforce, to really be able to raise the needs of the carers from all the populations. But like the work we do, because we deliver social prescribing and behaviour change services, we know if we design services for the most marginalised, the least activated, the most in need, then anybody can access them. So that's why we're starting with one of the cohorts that has the most stigma around and are the most marginalised, really. And our aim is to make the care and conversation as normal as smoking conversations are now, because if you think back 20 years, people really struggle to have that conversation about, are you a smoker, what support would you need? So we're really trying to normalise having that caring conversation with people and really normalise the fact that you are a carer and the support you need. And one of the themes we want to ensure that is underpinning is to make visible, make heard the carer's voice. So we're very much co-creating this and involving the carers across the organisation, across the system. Next slide, please. So in terms of a toolkit, we're very much approaching it with our behaviour change background, with behaviour change theory, and wanting to make sure that it has a range of resources. Some of those resources might be around raising awareness, about increasing confidence, actually providing policies, documents, campaigns, etc. Whatever organisations and professionals are telling us they need, and then working with carers to ensure that the content of that is appropriate and really brings to life their needs, their stories, and their wants. So we want to make whilst we're focusing on the most marginalised, i.e. people who are caring for people with substance misuse, etc., we wanted to pull together all the different training, all the different organisations, all the different resources that already exist but are largely hidden, like the carers themselves. We want to develop a generic toolkit, but that can be very much adapted and made bespoke for different cohorts across the communities, and we're going to draw in the carers with a lived experience to support us around that. And then from a sustainability point of view, it will be very much embedded within the council's carer strategy, but also we'll be developing a train the trainer model. So whilst we'll be developing an actual resource, a home to house the toolkit that everybody will be aware of and have access to, we also know that some of those more practical skills, some of those more, actually, I've got some challenges and barriers to this, we can support people on an individual or group level by having a team of influencers, people with a great amount of passion for this, and they can take forward as our champions, our train the trainers. Next slide, please. So building on phase one, we've brought together the key organisations, and we've got, with the support of the council, they're taking a lead and chairing steering group. So we've got some organisations who are already trailblazers and some organisations who really want to improve and have really got a lot of experience to share. So we've been coming together and starting to map out, okay, what already exists and where are the gaps, and that's at the stage where we are at. So we're going to be now starting to understand what resources is needed and working with the caring organisations and those with the lived experience to start to bring to life, like the previous speaker, building on the Think Carer video that we already have and starting to add more stories, more voices, because we all know we can go and listen to presentations, and like we've heard today, it's actually the experiences, the lived experiences that really resonate with us as professionals and make us want to improve things and want to do more. So that's, again, repeating myself, but that's the underlying theme. And so where aim is in January to test the training end, the awareness raising end, and some of the resources that we've developed with some of our professionals. And we've had a session just this week where we've been mapping out the touch points of some of the most marginalised, and we're pulling those together as our guinea pigs to test it in January. So that's where we are. Thank you. Hazel, anything to add?
Fantastic.
It was superb as always, Sue. Thank you.
Thank you very much. I think we've got getting more comments as well put into the chat box, so we'll pick those up later. Thank you very much there, Sue and Hazel. Apologies, I think my internet connection is just playing up again, sorry. If we can have the next presentation, please. It's coming from the Southeast, which is tackling inequalities in service provision for vulnerable or less ahead carers. Amelia.
Hello, thank you very much. So my name's Amelia Abbott. I'm from Southern Health NHS Foundation Trust, and we cover all of Hampshire with various different services, typically in the community and typically mental health kind of services, but it's probably easier to explain what we don't do than what we do. But I won't go into that now. So building on our project from earlier in the year, we are collaborating and continuing our collaboration with Hampshire Young Carers Alliance. We've also onboarded a new organisation, new to us as Southern Health, not new to Hampshire, but this is No Limits in Southampton. So we're really excited to get them on board as well. Next slide, please. If you hadn't already guessed, our focus is on young carers and promoting that piece of work. So we have thought about what we already know. So we drew out some key themes from the Mind the Gap scoping survey that we conducted with young carers across Hampshire back in March, and I'll come on to that in the next slide. But we also know that referral rates from Southern Health and other organisations, NHS organisations across Hampshire to young carers groups and organisations is incredibly low, at less than 1% of their overall referrals. So this is going to be a good benchmark, and hopefully over the next 6 months to a year, we will see that referral rate improve and increase. Hampshire Young Carers Alliance and No Limits work very closely with local schools and deliver a lot of training around young carers. So that's fantastic. That's a great start. Instead of reinventing the wheel, it may be that we explore some of those training packages and consider how we might integrate those into Southern Health as well. Similarly, they also have a lot of case studies already available. So again, we might just adapt some of these or provide them as resources and make them available to our staff too. Whenever I've had conversations with the young carer organisations, school nursing always comes up, and we do provide the school nursing services across Hampshire, so it makes sense for us to have that conversation. What we've learned recently is that the school nursing support to young carers remit has actually changed a little bit over the past year plus, and this is typically due to sort of national changes to funding and that kind of thing. But the young carers organisations are definitely identifying that as a bit of a gap that probably needs to be explored further, or at least join together our school nursing services together with the young carers organisations so that we have a bit more of a collaborative approach within schools as well. So these are just highlighting some of the things that we're aware of. And at Southern Health, we've done a lot of work over the last 2.5 to 3 years in raising awareness and understanding of carers, generally speaking, across the trust and with our staff. So we've trained about a third of our 6,000 strong workforce in carer awareness. But that is still ongoing work. There's still a lot to be done there. And in all honesty, if I was to then mention the idea that young carers might exist, I think some of our staff would be quite shocked, quite surprised. It's hard enough for them to recognise that a carer might exist, let alone someone that's under the age of 18. So this is what we're starting with. This is our kind of base point and what we're hoping to improve on. So next slide, please. I mentioned about our scoping survey that we did last year as part of the previous piece of the project. And the survey findings, we sort of developed 3 key themes really from the responses that we got from the young carers. And a lot of those were to do with support to the young carer themselves, but a lot of them identified better support, better services, improvements that we could make to our services to be able to support their loved ones. And they also highlighted the key collaborations that need to take place with external organisations too. So in regards to the young carer and the support that they want from our services, it's to be involved in appointments and involved in care. It's that emotional support that they might need as being young carers. It's the education and the advice that our staff, our healthcare professionals, can provide to the young carers so that they can understand their loved one's condition better or understand how to better support and care for them. And it's also just that general awareness amongst our clinicians of young carers and that they exist. Support to their loved ones included things like family support, accessibility to healthcare, continuity of care, and better support to their loved ones. And then the collaborations that they highlighted were with schools, respite for young carers, peer support, young carers groups, and primary care. In fact, a handful of them, when asked, what can we do better at Southern Health to support you as a young carer, it was fund our organisations, fund our projects and fund our activities. So a little bit of work that we can do there, certainly. Next slide, please, Steve. Thank you. So we had an initial meeting, and this was pulling together our colleagues from Hampshire Young Carers and from No Limits as well. And we had a couple of other interested parties. So a lady that used to be a young carer for her mother, and a lady whose son is a young carer, but not for her. Confusing. Anyway, so we brought together quite a few of us with lots of different experiences, expertise and understandings, and we wanted to really focus in on what is the main sort of target audience that we can work with to improve that engagement at Southern Health. So our key focus is going to be on young carers for parents with mental health, and the reason for this is because the whole aspect of mental health, there is a lot of stigma associated. It's very complicated and complex. A lot of parents with mental health may not come forward with a young carer because of fear that perhaps children's services might step in, that kind of thing. But for our project leads, they also explained that actually, if the diagnosis is written down as being a physical health condition, there is typically a lot of mental health or mental well-being that's associated with having those physical health conditions as well. So this would be the sort of optimum cohort to sort of tap into. But this doesn't mean that we're going to turn anyone away. If any young carers come forward and want to sort of share their experiences, of course we'll work with them. The main focus will be on aged 14 years plus, and the project leads explained that that was because they had so much experience, so much expertise that they could already bring, and a lot of really clear insight that they would want to share. And we would also like to focus initially on key theme 1, which is all about the young carers and their needs. So what we at Southern Health can do better for the young carers themselves. Along the way, that will develop into what we can do for their loved ones. And because of this collaborative approach with all of these different organisations, we're hoping that theme 3 of those collaborative approaches too will sort of tie in. So since October, so October through to December, the things that we've been working on are a staff survey for our staff at Southern Health, and this is just to sort of baseline their awareness and understanding of young carers initially, and we hope to deliver this same survey in a year's time and hopefully see some improvement there. And we're also getting out and about, which is lovely for me. I get to go to some young carers groups to meet with them and to identify some of the actions and the priorities that we can be working on. So next slide, please. I think the next slide just gives you an idea of what our staff survey kind of looks like. But the intention is, like I say, that we would complete this at this point, and then we'll see what happens again in a year's time. Can we see the next slide? Can we move to the next slide, please, Steve?
I think because Helen is moving the slides, one of my colleagues, and she's struggling. I'll see if I can move them from this end. 2 seconds.
That's okay, don't worry.
Hold on. Oh, there we go.
Lovely, thank you. So yeah, so this is just an idea of the staff survey questions that we're putting out there. We initially wanted to go in with what is a young carer and just see if anyone did actually know what a young carer was. And then the next page will move to a statement that explains what a young carer is. So once they've already answered that question, and then ask them a few more questions about, you know, the ins and outs of what they do if they find a young carer. So next slide, please. So these are the discussions that we've been having with the young carers so far. We've sort of come up with 4 kind of discussion topics, which we hope address that key theme in a little bit more detail. So the first question is really all about what our healthcare professionals need to know about young carers. And the idea of asking this question was so that we could potentially feed this into training or resources that we can develop and co-produce for our staff so that they can understand what a young carer is and what the value of working with the young carers are. I love that mini doctors bit. Next slide, please. The next question was all about that kind of involvement piece, that engagement side of things. So working together with the young carer for the best outcomes for the service user, for their family members. So we asked them whether they'd felt included. You can imagine the majority said no, not at all. One person did feel that they were involved once, and that this actually gave our clinicians a bit more insight into the person that we were providing that care to. So again, this kind of information will be able to use for resources and training developing moving forward. Next slide, please. I think the next question was all about the information and advice that young carers might want from our healthcare professionals. So there was a lot about information about diagnoses and what to do if, that kind of stuff. So again, we're hoping that this might help us to co-produce and develop some resources for young carers. So information about specific diagnoses, information about different, I don't know, medications or treatment options, and that side of things. So next slide, please. And then the final question, I think, was just open to anything else. So what else would you like to tell us? And a lot of these statements, the ideas that the young carers have, were very similar to a lot of what our adult carers tell us as well, and also what our service users tell us. So these insights are feeding in directly into our engagement strategy as a whole for the whole trust as well. Okay, next slide, please. I think this is the final one. Yes. So this is just to give you an overview of our timeframes and what we're sort of hoping we can achieve over the next few months. So obviously we're continuing with our focus discussions at young carers groups. We've got the staff survey that's out and about at the moment. In January, we're hoping to bring together some young carers who I will hopefully have met over the next couple of months, and really start to develop this idea of a young carers board. So in Southern Health, we actually have a youth board, which is fantastic. This is young people and their voices being heard within Southern Health, but we want to kind of parallel that with young carers. Off the back of that meeting, we're hoping that there'll be some actions that we can deliver quite quickly. So hopefully we'll do that. March, we'll come together again to see what progress has been made and what the next steps need to be. And we're hoping that at that point, we'll have a really good working document of a young carers plan. So a list of the different activities and actions that we want to take forward over the next year. And we're hoping to present that to our board and to the rest of Southern Health as well. there will be other stuff that happens between March and November, but I just wanted to highlight that November, December sort of time, we'll redo that staff survey so that we can hopefully see some kind of improvement and some kind of change. And that's it from me. Thank you.
Thanks, Amelia. Really appreciate it. That's fantastic. We've got our colleague Paula Cruz, who's the program lead for the carers work. I'm sure she's on the call today, and she'll be looking forward to link in with you at some point in the future. Really good. I'll share the details with you if you haven't already got them as well. I'll put them in the chat box. That's really fantastic. And we're moving on to the questions. I think the first one, I'll start with you, Amelia, which has been put into the chat box by Verity, which is to say, how many of your staff are young carers?
How many of our staff are young carers? So I suppose our staff wouldn't be young carers, given that they would be in.
I think Verity wants to say something. You're on mute. I'll see if I can unmute. Hold on. Oh no. You'd have to do it yourself, Verity. You have to unmute yourself.
Did you just mean carers? That's okay, Verity. I think you're asking how many of our staff are carers at Southern Health. Yeah. Is that right? So we have no specific way of knowing. This is something that we've been exploring separately as well. So we have developed pieces of work around our staff carers, and we're through the work that we've been doing with our staff as carers, that understanding of carers generally speaking has definitely increased. Yes, exactly. So low awareness to begin with. Once our staff start to realise that they're carers themselves, then they start going, oh, actually, as a carer, I would like to understand more from staff, from healthcare professionals. So yes, about a third of our staff are carers. Yeah.
Thank you. It's working now.
Oh, it's echoing as well at the same time. Thank you. Okay. I'll just open up the floor to people who've got questions. You could have questions for ourselves, or you could have questions for the regional leads. You know, we always use these sessions for learning and sharing best practices, and also linking in, helping the sites to link in, especially those who are doing the similar sort of projects. I think this year we've got three projects that are doing the veteran carers work, and two which are doing the alcohol and drug misuse projects. So we always use these sessions as well as a way to help you guys link in and share best practices. So please, the floor is yours. Any questions? You can either put them in the chat box or raise your hand. They say silence is golden, but I'm sure you've got questions.
Steve, it was just a comment on something else. Di, you said you were setting up a hub in Poole, I think you said. I don't know whether you've already been able to log into your local Up Courage team, but I'll stick our email into the chat, and if you'd like to, drop me a line, and I'll be more than happy to link you up there.
Thank you. That would be great.
Thanks, Jonathan. Amelia, did you want to come in with the point that you've just said in the chat box?
Sorry, I was just adding more to Verity's question. That's all.
Okay. Thank you very much. Any questions?
It's a bit off topic, but I think that was an interesting point about because we are trying to do that as organisations. We know that a lot of our staff are carers, and they're likely to be the more mature member of staff with the long service. So that is something that we're looking at to try and see how we can support our staff who are working carers in a different stream of work.
Thank you. Verity, would you? Oh, it's Chris. think you're on mute again, Chris.
I'm not going to get this whole muting thing right, am I? Just one thing for all the colleagues working on the military projects, and obviously this is not a thing we can solve at a local level, but one thing which really interests us, and it's this whole thing about, you know, identifying carers, but also getting people to think actually that they're carers themselves. And the Canadian military, what they do now, just like us, is they assess everybody leaving their armed forces. But on top of that, they actually assess the spouse or the nearest family member. And what they've discovered is 1 in every 5 people leaving their armed forces are actually being cared for. And when you think that a lot of these people are aged, you know, 30 to 50, we're not talking about the retirement age we would normally consider, you know, 65 to 70, that 1 in 5 people are being cared for. And obviously there's real benefits to doing that as well, in getting the person to understand, actually, I'm caring already. And I know that there'll be these challenges ahead. And, you know, so to be able to be working at that point of motivation could be really important. And one of the many things we would like to do is actually write to the government, because again, I don't know if colleagues saw that, you know, there's a family strategy now for the military, but, you know, quite rightly, a lot of it focuses on actually family life between the parent and the child, but actually there's not a lot of mention about caring roles. And so I think nationally that there has to be change in the focus as well. As well as the brilliant work we're all doing locally.
Thank you, Chris. Jonathan, you've got your hand up?
Yeah, it's just actually, I think Chris makes an absolutely brilliant point. I think personally, I think everybody should be assessed on the way out, because a lot of veterans especially don't put their hands up until 10, 15. I think, Di, you mentioned it, 10 or 15 years after the case, because actually it's the crack on attitude that people have, and that's not the veterans, it's the families as well. And I think that at the moment we're struggling, especially in terms of getting the military to even ask the question in a subtle way, should we just put it that way, to people who are leaving, that serving personnel. And I think, unfortunately, until we can get that one right, that's when we can start focusing on the families. But I do know that a lot of people leave and they're going, well, I haven't got mental health problems, because of the attitude when they're serving, I think, as much as they have, and that rubs off on the families as well, which is why we're trying really hard to reach out and actually just have a normal conversation. A couple of times people have said about, you know, being careful about not having a one size fits all. I know from personal experience that I can have gone through the same thing as somebody else and not react in the same way. And I think we've got to be careful not to make sure that we don't have a here's the carers package, good luck. It's got to be based on the needs of the individual. And I think that's what we're picking up very much in terms of the stuff that we're getting back, Katie, I'd suggest.
Thanks, Jonathan.
Steve, can I just add to that? I mean, just for colleagues not involved in the military projects, the whole thing about culture is just so important. And just briefly on the families, whereas I'm not making any comment about any colleague here, but we can actually be married to somebody, live with somebody, and actually really have very little idea about what they do at work, or there are some couples like that, some partnerships. Whereas if you marry into the military, you really have to buy into it, or it's not probably going to last very long. And so what develops is this whole culture about not letting the team down. And so, if husband, wife says, no, I'm coping, it's very, very difficult for the nearest family member to say, no, you're not. And in fact, I'm going to go and talk to the welfare unit about this. There's a really high expectation within the family, but within the armed forces, that everybody's really buying into it, and that's quite challenging to break. And as Jonathan and Di have said, you know, those sorts of, you know, that culture can last for a long time after leaving as well, if not for life as well.
Thanks, Chris. I think you've all mentioned that, you know, what you've mentioned, it highlights the importance of the work that you're all doing in terms of trying to help to identify and support all these carers and put all the plans in place for them to get access for the help they need. Verity, have you got anything you would like to add? I'll come to you first. If your Wi-Fi is working properly.
I hope it's working. Can you hear me? And is there a horrible echo?
Yeah.
There we are. Got so many devices set up and very few of them are really working. I think it is amazing to hear all the progress that has been made. And I think the themes that are coming up in the chat are really around one size doesn't fit all. And it's really important to be having these conversations with these communities. And I think it's great that we are getting into that kind of agenda around supporting those who are most in need and are most likely to kind of not identify and not get the support they need. And we're able to share that good practice in terms of what works. And I'm really looking forward to hearing in February how you've all got on and where we go from here, and then thinking about how we share this learning within and across those systems. So just thank you, and it's amazing to hear how much you've done in such a short time.
Thanks, Faye. Any of the regional leads would like to add anything? I'm sure we've got all the regional leads on the call today. Thumbs up, thumbs down? No?
I would also like to say well done, Steve. Go on, Campbell, over to you for sharing.
No,
last minute.
Thanks, Steve. And sorry, just because you invited us, Steve, but just to say thank you. I think the biggest thing that I'm getting is, and my projects now in my region, obviously, but it's just the amount of energy that's going into this, and it's just really appreciated. So thank you.
Awesome, thank you. Is there anyone else who's got any feedback or any comments? No. Okay. The next thing that I just wanted to bring up was just the next steps. So we've got our national, yeah, there we go. Thanks, Helen. We've got our 8th Commitment to Carers conference, which is on the 7th of December, which will be held in London. Unfortunately, as we would like to invite you all, but we've got limited number of places. So we've got a workshop, which is our Mind the Gap workshop, and we are going to invite 3 sites to come and present on the day. The outcomes, we'll try to see if we can grab the outcomes and share with the whole entire group that we have here. Got the 10th of January as the date set for our 2nd interim report, which should be due with the regional leads. And we've scheduled in another Learn and Share event similar to this one today on the 23rd of February, with the final report due on the 10th of March. And hopefully we'll have the 21st of June for our celebratory event and another next steps in terms of knowing where we'll go regarding the project as well. If you've got any questions, please feel free to email myself or your regional leads, and we'll be able to help you if there's anything that you need to know. That is it from me. If you've got anything you want to add, please feel free to put it in the chat box or just drop us an email.
I was just going to say, Steve, in terms of the chat box, there was some conversation about resources and things that were coming up that people were going to share amongst themselves. And actually, if you send them to us, if appropriate, and at the point that they're able to be shared more broadly, we can put them on the Futures platform. There's a Mind the Gap section, which has got all the case studies and resources. So if they are at that point, please feel free to share them with us and we can share them amongst you guys and also more broadly.
Thank you very much.
Thank you.
I think we finished a little bit earlier today, so you can go grab a coffee, teas.
What happens when you chair, Steve, not me? Well done.
the last slide, I think, yeah, Helen's just shared, we've got our Lunch and Learn webinars. And I think the next one that we have coming up is on the 23rd of November. So please do register and share with your networks as well. Thank you for coming today.